check karo. Is it fine? Okay. Namaskar. My topic is, I'll just cover in 3 points. Number one, what is the infrastructure of CCRH? Then what research activities we are engaged in, the key highlights I will go through, and the future trajectory, the road ahead. And I have time of 10 minutes. So I'll 15 minutes, okay. By 4, I'll be okay. Take care. So under the aegis of Ministry of Ayush, CCRH, that is Central Council for Research in Homeopathy, is an apex research organization which undertakes, coordinates, promotes, develops and disseminates scientific research in the field of homeopathic system of medicine. CCRH is basically engaged in multi-dimensional research activities. Say, for example, to start with survey and collection of medicine plants, cultivation of medicine plants, drug standardization, drug proving, clinical verification, clinical research, clinical validation, literary research, epidemic research, and we are also doing many public health programs in research mode, and so on. Council undertakes these research studies through its different institutes and units spread across the country. Currently, we are having 34 institutes and units, where along with these research studies, we are providing clinical care. We are also having laboratory facilities, and at some institute, we are providing IPD services too. We are also engaged in basic and fundamental research on biological models, that is in vitro and in vivo, and on physicochemical models with the collaborations of many institutes of national repute. Yeah. So these are the research activities I was just talking about. This is our infrastructure. In India, we have these 34 institutes and units. And our vision is to undertake and promote research that contribute towards the development of homeopathic system of medicine globally, especially for public health. So we are of this opinion that there should be a translational research treatment outcome for the suffering humanity. As we all know that the translational research is which undertake any scientific discoveries made in any laboratory, in a hospital, in a clinic, or in a public outdoor activities, and transform them into new treatment and approaches to set up the new treatment approaches for the suffering humanity. So our main aim, as you all know, that the goal of medicine, as Sir rightly said, is now no longer merely treatment of sickness. The other and more important goals which have emerged recently are PPI, that is called prevention of disease, promotion of health, and improving the quality of life of individuals and communities. So now we in CCRH we are focusing on that how the outcome of our research can help the end user or can be beneficial to the general homeopathic physician to provide better help in form of health to this suffering humanity. So our mission is to conduct scientific and ethical research, thereby promoting this safe, gentle, cost-effective, quality-assured, and evidence-based treatment system into healthcare delivery system, plus enhancing the success rate of clinical practice for a general practitioner, and ensuring the global acceptance of homeopathy. So for this, what I've just shown, so we are into the accreditation process, NABL and NABS, these are the institutes, and I'm just going through the pictures. These are some of our institutes. These are our research laboratories. These are under construction and under process, the new our institutes and units. And we have, this is the OPD figure, around 7,23,074 patients we have treated in last 1 year, and we are taking charges from them. Previously it was free of cost, but now we are charging them or consultation and laboratory tests, everything. So now figure is bit dripped down, but we are earning money out of these. And this is one AIHMS, that is Ayush Hospital Management Information System for all Ayush systems. And I'm happy to share this thing that our two institutes, Noida and Kottayam, are always in top 3 of all Ayush systems. I think we deserve a clap for this. I don't know you are whether listening or me or not. Because लंच का कुछ ज़्यादा नशा हो रहा है, कुछ रिएक्शन नहीं आ रहा आप लोगों की तरफ से. So for this survey and collection of medicine plants and for cultivation of medicine plants, we have one unit at Ooty. We have 12.7 acre land at Ooty, where we used to cultivate the exotic plants because the climate of Ooty is just similar to the European conditions. So we are cultivating 92 exotic plants there. So total out of 112 plants, 92 are exotic in origin. So just go through the pictures. Yes, we have done this seminar there. A lot of pharmacy students used to visit there. Another program is drug standardization. As Sir Manchanda sir rightly said, we are standardizing the drug because the purity and quality of any medicine prescription, success of any prescription depends upon the quality and purity of the medicine. So we are doing work for this, and there are three types of studies in drug standardization. One is pharmacognostical studies, another is physicochemicals, and third one is the pharmacological studies. So first two, this pharmacognostical and physicochemicals are purity and safety, and this is for quality, etc. So we have done studies in these aspects like this, and we are having herbarium sheets of 11,717 at our Ooty center. This is the graph, if you can go through, and there are three bodies which are doing drug standardization. One is Pharmacopoeia Commission of Homeopathy and Indian System of Medicine. Another we are doing with the collaborations of BIS. Sir is here. This is the work we have done with BIS. 19 Indian standards we have developed. These are the important publications through this drug standardization programs. Another is drug proving. We have started our drug proving program from Bihar, Bhagalpur, from one center, and now we are having many centers with us. Now we have collaborations with 22 homeopathic medical colleges also. This is our drug proving program. These are the important publications. We have developed a real-time web-based portal functional since 1st April 2023. And now there is paperless work. Drug proving from data from the colleges now coming through online only. Another program is clinical verification. After drug proving, this clinical verification is a very successful program, and we are engaged since beginning in this program because we have to verify the clinical symptoms, whatever we get from the materia medica through drug proving. So we have concluded 126 projects. Projects means the name of medicines. So our focus is on Indian indigenous drugs. This is the total important books what we have published. On these 10 drugs we are working now. Another program is clinical research, and we have taken 345 conditions, clinical conditions which we have worked, and out of those we have 400 plus publications. So these are the clinical research areas we have worked on out of these 345. These are the books we have published out of this. Now when we talk about the fundamental, so fundamental because everyone knows that homeopathy works, but how it works, so that is the question mark, and that is why we are working on this project now. And this initiation was done by Dr. Manchanda sir in his tenure, 2018 sir. And now we are going forward in this. So this is what we are doing in fundamental and basic research. So we have concluded 80 studies, and ongoings are 117. And we have published 81 publications out of it, and in pipeline 26. So what we are doing, when I just told you that we are collaborating with the many universities of national repute. So you name the university, we have the MOUs with them. Just have a glimpse of this. In first 43 years, we have the CCRH has 85 MOUs, and in last 3 years we are done 2 to 6 MOUs. So now we are having 311 MOUs, and they are working, they are non-homeopaths, and they are working for us. All physicists and chemistry from department, biochemists. So this is good for homeopathy health. These are the common universities which I am talking about. Many IITs are there, AIIMS, and so many big names in universities. These are some of the work which are going on. It is too small. And out of this, we have 9 file patented was done with us, from us, and we granted 2 because it takes 7-8 years to complete the process. When we talk about the epidemic research, so this is the data from epidemic research. In COVID time, we have done a lot of works. We have published the health advisories, we have published the guidelines for, in case of dengue, Japanese encephalitis, chikungunya, flu-like illness, COVID-19. So we have advisories for this and guidelines. What to do and what not to do. These are the common conditions on which we have done. This is the COVID-19 data. We have done 25 studies in COVID-19. And our 17 publications are index journal publications from this. This is the contribution of CCRH. We have done so many publications in those days. These are our common publications in top-notch journals. No need to go in details. I have 5 minutes more. So this public health program, our beneficiaries are more than many crores. So you can see the figures here, 55 lakhs, 35 lakhs, more than this. So we are doing these studies in public health program, and all these are in research mode. This is the SCSP plan we have, scheduled caste sub-plan. Out of this, we got a special fund from the government, and we are doing on these underprivileged communities. We are also doing public health program in menstrual health, in adolescents, school-going girls. And this is the data. No need to go in detail. We are also working on menstrual disturbance, then galactose activities, menopause, dysmenorrhea, amenorrhea. So all these things we are doing. And when we talk about linking research with education, that was the initiation by Dr. Manchanda sir. At present, we have MOUs with 87 homeopathic medical colleges, through which we are running our research methodology program. We are teaching them, or we are doing training for them. We have started scholarship programs, STHS, short-term studentship, and MD. These are the objectives. For STSH program, we used to give 20,000 to the undergraduate students. And for quality MD dissertation scheme, we are giving 50,000 to students. This is the number which we have given to the awarded 497 in STSH and 84 since 2014 and 17. This is a very famous program of RISE, with the name of RISE. RISE means Research Interaction for Students, Enrichment, Enhancement, and Encouragement. Dr. Anupriya is here. She is leading this program. And we have 7,000 to 8,000 attendance every month in these webinars. So all the faculties of our collaborative colleges, their students, they are used to take part in it. And every month we are organizing this. This is the research disseminations. This is the IJRH, our Indian Journal of Research in Homeopathy. And we are in number 2. We are on number 2 in words after homeopathy. So this is the index journal, and it was made online in July 2023. We have done so very good work. This is only Scopus Index Journal. And if you see the downloads, so it was 1,052,022 downloads last year. And Dr. Harleen is here, who is single-handedly doing this, so she can do in her presentation. In this is a very good achievement of CCRH. Other publications, just have a glimpse. These are the, as sir was just told about the standard treatment guidelines, then our good clinical practice, then scientific framework of homeopathy. We have developed this STSH mobile app. Now standard treatment guidelines are available on mobile of your students. This is what we are doing. In October, we have done our scientific advisory boards. So now we are doing 350 studies. And these are the breakup. Out of this, 41 concluded. So we are running 309 studies at CCRH right now. This is the summary of research activities because our research have developed one stage. They have given a very solid base. So now we are taking off from that. So this is the progress of CCRH nowadays. And this is a publication. Out of this 783, we have published almost 52.6% of total of this publication in last 3 years. So because we have so many studies, so we have so many publications. We are engaged into exhibitions, Arogya Melas, like this, and you can see our Prime Minister and our ministers. We are doing webinars with these participations. This is another webinar, what Dr. Anupriya is doing. This is a capacity building program. We are doing training programs. We have documentary, short film for promotion of homeopathy. These are their names. We are doing World Homeopathy Day celebrations, as you all know, since 2016. In 2018, we have started in 2016. Since 2024, we have invited President of India with the attendance of 8,000. And in 25, we have done Gandhinagar. Dr. Pinakan Bhai is there, and with his Gujarat team, we have crossed the attendance of 10,000, 10,143. So I just want a big clap for him. This is our digital initiative. We are doing HEDOC, we are doing CCH library, a lot of things. This is our website. We are on social media also. This is the future trajectory of homeopathy if we talk about. So we can collaborate with Hamai, as one offer was there, we can collaborate with Hamai. And the interdisciplinary convergence, integrative research we are focusing on. We are adding on homeopathy with whatever the treatment protocol is. We can harmonize the things, regulatory and ethical guidelines. We are in touch with NCH. We have done MOUs with them, and we are harmonizing the things. These are the research priorities, majority with evidence volume, pragmatic and real-world evidence we are doing. We are focusing on complementary role in prevention because we are focusing on public health. So this is our another research priority. Then digital cooperation, because today is the world of AI, so we are doing this work also. If you are interested, so these are our links for digital presence. We are here. And this is CCRH, as you all know, another name. You can say CCRH as Committed to Credible Research in Homeopathy. Thank you. I think I have done in time. Thank you.
Thank you so much, sir, for your insightful presentation. Now I would request Dr. Subhash Singh, sir, for his discussion on pathological cases and its different approaches in homeopathic treatment.